1, 2,
3,
4,
5.
6.
The number of people who have gone without health care has grown by 20% in the last 10 years. So the healthcare reform will expand coverage to the non-covered. It will reduce premiums and also reduce your out-of-pocket expenses. The healthcare reform will benefit many people. It will benefit families in many ways. One of the things that it will do for families is it will ensure protection to families in the insurance markets. The insurance companies now can put a gap on how much coverage that you are allowed to get when you're covered through them. So now with the healthcare reform, they can no longer put lifetime caps on your insurance. Another thing that it will help is your pre-existing conditions. If you lose your job and you lose your insurance and you get another job, a lot of companies, they tell you have to wait a year to get insurance coverage because of your pre-existing conditions. Now that will no longer be active. If you lose your job and you get a new job, they have to cover you no matter what. Also with the healthcare reform, you get free screening, meaning colonoscopies are free now so they can check for cancer. You can also, women get free mammograms now to check for breast cancer. So those are just a few things that benefit the families when it comes to the healthcare reform. Another thing that it benefits, another group, are the senior citizens. Healthcare insurance companies now, if you are a senior citizen without insurance and you try to get insurance, they will not cover you if you have high blood pressure or if you have diabetes because the risk is too high for them. So with the healthcare reform, it allows the elderly who have diabetes and high blood pressure, it allows them to get insurance. They can't deny you anymore. The prescription drugs. There is a cap on Medicare for prescription drugs. And if you find yourself in the donut hole of the prescription drug costs, then the government will cover 50% of your generic drugs, and all you have to do is pay the other 50%. So it actually helps with your prescription medications. The healthcare reform provides stability, security, and choices for people to make from 2010 on. When you pay for insurance, there is a thing called hidden tax. The hidden tax basically is a tax that they take from your insurance that helps the people who don't have insurance. You're basically paying the government extra money for those who do not have insurance. So if they were to get sick or go to the hospital, basically the tax out of your insurance money is paying for those who don't have insurance. So with the new healthcare reform, Obama says you can't do that, that they will no longer take the hidden tax out of your insurance. Another good thing that it will do is for those who cannot afford healthcare insurance. There is a lot of companies who have skyrocketed their prices in the last 2 years. So with the healthcare reform bill, they have done a thing called tax credits. When you do your taxes, if you fall in the guidelines that they have set, they will pay you a certain amount for you to get insurance so you can be covered. So that is some of the really good deals that the reform actually does do for people. So today I've pretty much talked about the way it helps families by free screenings to check for cancer. I have talked about, I've talked about the senior citizens. They can no longer deny them for diabetes or high blood pressure. I've also talked about how it helps with the prescription drug costs and how it will help people get insurance regardless if you have a pre-existing or you don't have a pre-existing. So I've gotten my sources today off the United States Department of Health and Human Services. That website gives a great detail of information on the actual healthcare reform bill. I've also watched an interview with President Barack Obama when he was in Iowa City in March. talking about what this year in 2010 the reform bill will do for you this year. And I've also watched the CNN live interview with Larry King, where our Secretary Kathleen Sebelius gets on and talks about the perks of the healthcare reform, why people don't like it, why people do like it, and different things like that. So that is my speech on the healthcare reform. Does anybody have any questions?
I do. Being a transplant kidney recipient, can I get insurance?
You can. With this new bill, you can now be covered.
Do you think the politicians will ever agree on what's happening with it?
No, I don't. No, I don't. Any other questions?
So everybody in the United States is going to be able to have insurance regardless if they have money or not.
Yes, because within the next 4 years, within the next 4 years, the president has put into effect a cheaper insurance where they can only charge so much according to your income and how things like that, how you make money.
What happens if I don't want insurance?
Then you get a fine.
About people that have insurance, what's it gonna do to their premiums?